Access to GP services is an important concern to many people in Greater Manchester. But here at the Nye Bevan Health Centre in Rochdale, it's doctors who are saying they're feeling the pressure of the current system. According to staff at the practice, whilst the call for greater accessibility to appointments has been heard, GPs worry that patients aren't always that keen to be seen.
The only thing I'm saying is when you make an appointment, either keep the appointment or if you don't need it, please release the appointment 24 hours before so that, we can offer it to somebody else. We do start the surgery on a Tuesday at 7 o'clock to give people who have to go to work a chance, to see the doctor. But even then, in those, people have DNA'd their appointments. They haven't kept their appointments. It's a two-way process, basically. If we offer appointments and they make appointment, they have to keep that appointment.
Between the 1st and the 21st of July, 254 people didn't turn up for their appointments at this Rochdale surgery alone. Staff here say they would like to expand services, but when so many people aren't turning up to appointments that they've booked in for, it makes it difficult to work out how existing resources are falling short. And doctors say it's not just about the no-shows. There's also an issue with people using GP surgery as the first port of call for minor ailments. And the combined effect is that it's often those who need to see a doctor the most who end up missing out.
There are people who have long-term conditions and they end up eventually going to A&E, and it's putting a lot of pressure on them. If you were to press panic buttons, if you have just a runny nose, I don't think that's appropriate. So, they have to take a bit more responsibility for themselves. And yes, if there's a genuine problem, we will never say no to anybody like that.
According to their contract, doctors should be able to guarantee patients an appointment within 48 hours. But the Healthcare Commission's last annual report for England showed that less than a third of trusts were hitting the target. Whilst some improvement must undoubtedly come from the GP surgeries themselves, those who use the services can also become more aware of the part they play. Georgia Calvin-Smith, Channel M Today.